Hi everybody, I'm Dr. Manisha Dansingani, and today I want to go through febrile seizures. Disclaimer, this is only for use in Starmed medical education Nacosce prep, and the information is for educational use only. This does not reflect an actual examination or the actual examination content, and is only made to help IMGs prepare for their upcoming Nacosces in Canada. The information is widely available online, and I used the same information to prepare this video. Okay, so here's your case scenario. An 18-month-old boy who presents with sudden onset generalized jerky movements of the body, frothing at the mouth, unresponsiveness, and urinary incontinence for 1 minute this morning. Mother noted he had a fever of 100 degrees Fahrenheit prior and a runny nose for 2 days. Take a proper history and address the mother's concerns. So once you've read this scenario, I want you to pause the video for 2 minutes and prepare how you're going to organize your thoughts to complete a quick history. Differentials should be running through your head as to what this presentation is mimicking, and this should help to guide the kind of questions you want to ask. Here is a basic breakdown of any pediatric history, which is not only useful for the NAC prep, but also for practice in general. So first things first, you want to establish your presenting complaint and your history of presenting complaint. And the best way to ascertain a history of presenting complaint is to always follow the template OCD, PQRST, UV, and AAA. And then you follow through quickly with the rest of the general history. So the birth history, the pregnancy history, developmental history, past medical and surgical history of the child, immunization history, family history, and the social history. Yes. It's important to ensure you get through the last parts because sometimes you're marked for these and they become easy marks to get an overall score in the station. Very rarely you'll pick up something that is important to the presenting complaint and in the history of presenting complaint, but it's not impossible to pick up something that's important either. So it's important for you to still cover all bases. Okay, so of course you want to go through the template, which is the OCD, PQRST, UV, and AAA. So O for onset, C for course, D for duration, P for place, Q for quality, R for radiation, S for severity, T for timing, U as in U with if it has associated the patient with any of their daily activities or their daily functioning, V for deja vu if there was a prior incident or episode, and then AAA aggravating and relieving factors and associated symptoms. So let's go back to our case scenario. So of course you want to ask the mommy when did the seizure occur and how it occurred and how long it lasted. You want to ask if there were any body parts involved, which body parts were involved, and if there were any warning signs that indicated that the episode might happen. Was there any post-ictal phase? So you can ask the mommy any drowsiness or weakness, headache, or confused state. You also want to ask her if this was the first episode and or if there were any other episodes prior. You want to Mommy should describe any events that had occurred during the seizure. So you want to ask her, in our case, our child had urinary incontinence, frothing at the mouth, and also jerky movements. There was no post-ictal phase described, but you can prompt her. You can also ask if there was anything happening at the time of the seizure before, where they were just in the room resting, if they were watching TV, were they playing outside. You also, in our case, it's a febrile seizure, so you want to know if the child was sick with a fever prior to the episode. And then in terms of the seizure itself, did it just stop suddenly or did it happen gradually where it stopped with different body parts stopping, or what? How did it actually stop? In terms of the fever, you want to ask mommy when was the onset of the fever? Was it sudden or gradual? You want to also ask how long did it last? What was the temperature, the actual temperature? Because a lot of moms might feel the child and say that the child was roasting hot or felt warm, but was there an actual temperature recorded for the child, which would be useful for you? Was it continuous, intermittent, remittent, right? And then you want to go into the fact that was this happening before, a couple of days before, where was the mommy giving the child any medication to relieve the fever? Was it a case where it was getting worse? Was anything making it worse? And of course, then you move into your review of systems with any fever. So you want to ask if there was any eye discharge, any otary or air discharge, any rhinorrhea or runny nose. You want to also ask about any cough, sore throat, difficulty swallowing, abdominal pain, vomiting, nausea, diarrhea, any urinary symptoms, so urinary frequency, crying when urinating, foul smelling urine, dark colored urine. If the child had any exposure to any ill contacts, or did the child travel recently out of the country? You also want to probe for any signs of child abuse. So any kind of predisposing trauma, any exposure to any medications, if there were any persons in the house like who had medications sitting around that the child might have gotten close to. You want to ask if there were any chemicals around the place that the child might have had contact to. You want to ask if there were any certain types of food the child had eaten prior that can predispose the child to having seizures. For example, not necessarily in Canada, but generally, for example, in Jamaica, where I'm from, ackee, which is our national fruit, can actually cause seizures in children from ackee poisoning. So we ask about that. And any preceding illnesses, right? So in terms of the rest of the history, you want to just quickly go through because you would have already come up with your differential by the time you complete the history of presenting complaints. These are just to see if there were any additional information that might have been useful and just to gather the points to show the examiner that you know how to take a proper history. So you want to go through the past medical history, the past surgical history, the birth history, mommy's pregnancy history with the child, immunization, are they fully immunized, any drugs that they were taking prior, if there was any developmental delay or if they're okay for their age, and like I mentioned earlier, any child abuse. Okay, so by this time you should already have your differential diagnosis. So of course, your top differential would be febrile seizure. And so when the examiner asks you what your diagnosis is, your top differential should be febrile seizure. If they prompt you for more, you can mention the other two, so meningitis and encephalitis. But please remember, do not pick too many fruits off the tree. In other words, if you mention too many other differentials, you may end up losing points and going down a path you didn't intend to, especially if you have extra time. So for most of the examiners, some of them will give you hints, but some of them are very, they don't talk to you, they don't give you any hints, so they may not do that. And so it's best to just stick to their mark scheme that they have, because some of them don't try and use their own judgment in that case. So your top differential is febrile seizure, and you may mention the other two if they prompt you. In terms of investigations, if they prompt you for what kind of investigations you want to do, if that comes up as a question, you're going to say complete blood count, urea and electrolytes, arterial blood gas, glucose, blood glucose, urinalysis, blood culture and sensitivity, lumbar puncture with a gram stain culture and sensitivity. Of note, the blood culture and the lumbar puncture would more be for the meningitis and encephalitis, not so much the febrile seizure. But if, for example, the case scenario was more representing a complex febrile seizure rather than a simple febrile seizure, you would try to include those as well. In terms of the management, if you're prompted by the examiner to give what your management plan would be, in any febrile seizure, the treatment is symptomatic treatment. So in our child, he had a runny nose, a fever, more upper respiratory tract symptoms. So you'd want to treat those symptoms along with the fever. So you'll give your antipyretics for fever based on the weight of the child. You can give acetaminophen, 15 milligrams per kilogram every 6 hours to ensure adequate temperature control. You want to ensure the child is hydrated, whether that be oral fluids or IV fluids. You also want to reassure and counsel the parents. So you're going to tell them what has happened to their child, why this has happened to their child, when, if any time again it might happen to their child, so any recurrence and what they can do, who this usually affects, in their child, 18-month-old boy. It's more common in children and especially in boys, and what can they do the next time this happens. If there is a recurrence of the febrile seizure or complex febrile seizure or status epilepticus, usually the treatment would entail anti-seizure medications or anti-epileptics, and so rectal or IV lorazepam is usually indicated in these cases. Overall, you want to treat the underlying cause of the fever. So if in the case there was no identified cause, then you would go through the protocol for fever without a source, which is a whole different topic on its own. I really hope that you have learned a little bit from this presentation and that it helps you in your preparation for your Nacosce. I'm wishing everybody here all the best and best of luck.